All right, thank you for staying with us. Now I would like to introduce our clinical registered dietitian, Jamie Rizzie. She is also a certified health coach at Rush University Medical Center. She specializes in medical nutrition therapy and nutrition counseling for neuromuscular disease, cardiovascular disease, weight management, and general wellness. As a member of the Multidisciplinary Muscular Dystrophy Association Clinic at Rush, she enjoys working with patients and their loved ones to determine an individual nutrition plan of care that best meets their needs. She is a member of the National Society of Health Coaches and the Academy of Nutrition and Dietetics, and is the membership co-chair of the Chicago Academy of Nutrition and Dietetics. So Jamie, thank you for being with us today. I will let you go ahead and share your screen.
All right, thank you so much, Nicole. Hi, everyone. As Nicole said, I'm Jamie Rizzie. I'm a dietitian at Rush University Medical Center in Chicago and a very proud member of our MDA and ALS multidisciplinary clinics at Rush. So it's my honor to be here today, and I'm excited to talk to everybody about the role that nutrition plays in the management of neuromuscular disease. Okay, so some of the objectives that we'll cover today are going to be to discuss nutrition-related concerns in people with neuromuscular disease, discuss the importance of adequate nutrition in neuromuscular disease, determine how to implement appropriate nutrition interventions, discuss the efficacy of alternative means of nutrition, and discuss the use of supplements in neuromuscular disease management. So first and foremost, what are the main nutrition-related concerns in neuromuscular disease? So in neuromuscular disease, hypermetabolism and hypercatabolism are extreme concerns, along with things such as appetite, swallowing ability, feeding ability, GI complications, nutritional deficiencies, and weight loss and malnutrition. So research suggests that folks with neuromuscular disease have an increased metabolic rate at baseline. So this means that their overall, oops, I'm so sorry. Sorry, I need to pause my video. So as I was saying, it has been kind of shown through research that folks with neuromuscular disease, in particular ALS and some of the muscular dystrophy conditions, have an increased metabolic rate. So this being that at baseline, because of muscle, sort of degradation over time and hypermetabolism, this population tends to have higher protein and higher calorie needs at baseline. So even at rest, it's been shown that some of these folks have between 20 and 30% higher calorie needs, in addition to higher protein needs than folks without neuromuscular disease. So of course, this is a major concern in the nutritional management of these conditions. And with this, in the nutrition world, BMI tends to be something that we look at to sort of, in combination with other things, to sort of assess somebody's overall nutritional needs. However, it's not a great indicator of overall nutrition status, as BMI is simply just a measure of somebody's height and weight. It doesn't give us an indication of muscle stores or status as far as that's concerned. So with that, somebody who might have an overweight or obese BMI in that classification, it's been shown that with neuromuscular disease, they can still have altered muscle stores. So again, BMI not being a great indicator. So we'll kind of talk a little bit more about that as we go through. So one very major concern in sort of the progression of neuromuscular disease is appetite overall. And appetite can be impacted by several different things. Decreased mobility, which can sort of occur as certain diseases progress, can significantly impact overall appetite, as well as things like GI complications, which we'll kind of get into a little bit later. Having problems with satiety, so, early satiety, so starting to eat a meal and then filling up, quickly or soon into the meal can be an issue and a concern. Things such as taste changes, so not just, food tasting different or not being appealing, but even the side effects from certain medications can cause altered taste, or things maybe to taste more metallic or more sour, which then of course can impact our appetite if food's not tasting the way that we think it should, or that we know it should taste like. And then swallowing difficulties, which we'll get into a little bit more as well. But overall, swallowing can certainly impact appetite overall. And aside from just these sort of physical manifestations, we also kind of get into the emotional challenges that play a role in impacting appetite. So, kind of depression or anxiety around meals can certainly play a role in how our appetite is overall. So swallowing ability is certainly a major concern in neuromuscular conditions, in particular with things such as ALS or conditions that are affecting more of our upper or bulbar symptoms. And with swallowing ability, things such as dysphagia or just difficulty swallowing can be very problematic. And a lot of times too, it's, our muscles in our esophagus and in our throats can be impacted by certain conditions, but it also can be the muscles in our mouth themselves that don't necessarily allow us to control the food in our mouth, or sort of move a bolus of food around to sort of get that down and allow us to swallow properly. So with that, if we're not able to manage a bolus of food, we might take in a little too much at once and perhaps choke, or have difficulty just kind of breaking down some of that food. Which then, if we're having issues with the swallowing, we can then be at a much increased risk of aspirating or choking on our food, leading to the potential for things like aspiration pneumonia or other such issues. And with that, just having an overall increased time that we have to spend at meals can be problematic. Not that it's a bad thing, but it can just make us, perhaps feel like a little bit worn out by the end of the meal, because we're doing all this work to try to chew and try to swallow, and the length of our meal is being extended. So we might feel, like as time goes on, we just sort of want to give up, or it's affecting, how we're feeling overall. And with that, just getting tired, using our muscles and using our body to really work overtime to be able to chew and swallow our food when we're having difficulty can just make us feel tired and fatigued overall, which can then sort of even impact our breathing status and things along those lines. Excessive saliva becomes a concern, especially in bulbar onset ALS and other similar conditions, because when we're having this excess saliva, either kind of perhaps falling out of our mouth or sort of going down our throats, it can increase our risk for choking, or just not allow us again to have that bolus control of food. And all of these things together can certainly evoke fear at meals, being afraid to eat certain foods because you feel like you might choke on them, or they might be more difficult than they used to be, or just sort of, embarrassment at meals is a big concern I hear from a lot of my patients. If they're not able to control food in their mouth, or they have to eat a different textured diet, that it might not be similar to their family members or people that they're eating meals with. And when we have this fear at meals, it can make eating a very much less enjoyable experience. And additionally, it can cause us to maybe restrict certain foods, which doesn't help, in the long run, overall for us to better meet our needs. And with that, if we're having issues with dysphagia or swallowing, we definitely want to consult with our speech language pathologist to make sure we're on the appropriate consistency diet, because there might be some recommendations for altering the texture to make it a little bit easier or more manageable for us, or talking to the physician, at some point discussing alternative means of nutrition or feeding tubes as a supplemental or total way to receive nutrition. So we'll touch on that a little bit more as well. Aside from just swallowing, the physical ability to feed can become an extreme challenge as well. So if, maybe swallowing function's not an issue, but if we're having upper body weakness or perhaps immobility, just the act of actually feeding ourselves and getting the food from table to mouth can be a challenge. And with this, we might need assistance from other people or, other adaptive equipment that can be helpful for us to better meet those needs and be able to eat a little bit better at meals. So consulting with your occupational therapist can be important if there are any uses for adaptive equipment at meals to help with that feeding process. GI complications are another concern in neuromuscular disease. We have muscles, of course, all over our body, but we also have muscles throughout our GI tract that help us to digest our food and absorb nutrients from our food. So with that, as we're eating, or as disease, perhaps is affecting our GI muscles and organs, the transit of food from mouth, out the body can be much slower, and it can cause changes in our bowels. We might be experiencing more significant constipation. We might have diarrhea. We might have just bloating or distension overall, which can, of course, impact appetite and not make us, maybe want to eat as much at meals. A lot of folks tell me, yes, I have constipation, but I also have diarrhea. So how is that possible? Kind of these alternating bouts of both. So there is something called overflow diarrhea, where essentially we're constipated higher up in the GI tract, and any fresh stool is trying to sort of go around this blockage of stool. So it comes out as more a liquid consistency or more diarrhea. But you're still sort of constipated. So it's kind of this battle of being constipated while also having loose stools as well. So that's definitely something I see pretty frequently. And all of these things, when we're having these perhaps changes in bowels or slower transit of our food, feeling fuller faster at meals, so that early satiety feeling is certainly something that can occur, as well as just the overall ability to consume a larger volume of food at one time. So we might be, used to eating a large volume of food and we feel satisfied, we feel full. Sometimes as neuromuscular disease affects our GI system or affects our bodies overall, being able to consume those larger meals can become a challenge, and also can affect, breathing status. If we're feeling that sensation of fullness, it can sort of make us, a little bit more difficult in our breathing. Now, with not being able to eat as much at meals, or our appetite's a little bit poor, more poor, sometimes we can develop nutrient deficiencies. So not just from a calorie or a protein standpoint, but vitamins and minerals, so our micronutrients. So I would say the most common deficiencies with some of the neuromuscular conditions, more so because we're not able to eat as much, are going to be things like vitamin D, calcium, iron, vitamin A, and then some of our B vitamins. So with vitamin D deficiency, typically, we don't really have very obvious symptoms of vitamin D deficiency. I'd say it's a pretty common among the general population, just in general terms. Vitamin D deficiency is fairly common, but doesn't always present symptoms. So if, as things progress, or if it's a pretty severe vitamin D deficiency, we might have things like fatigue, or maybe some bone pain, or even changes in our mood. So we might feel sort of senses of depression, or just changes in mood overall. Or even in advanced stages, we could start feeling manifestations in our muscles. So weakness, cramps, or body aches. With calcium deficiency, it's kind of similar to vitamin D deficiency in that there aren't necessarily obvious symptoms in early stages. However, as things sort of progress or advance, we might have, or certainly have an increased risk of bone fractures, or things such as osteoporosis and osteopenia. If they're very severe, if it is a very severe deficiency, we can have things like confusion, or can start affecting our memory, and then getting into the muscles, having spasms or cramping, or even numbness and tingling. And it's important to kind of speak with your doctor, or maybe get your vitamin and mineral levels checked, just to make sure there isn't a deficiency, especially in calcium and vitamin D, because with these conditions or these deficiencies, a lot of times in the treatment of certain neuromuscular diseases, if we're on steroids or things like that, those medications themselves can put us at a higher risk of loss of bone mass. And if we're having issues with mobility, or maybe we're wheelchair bound, or we're just not able to do weight bearing activities that can help us build up those those bones, if we're not able to do those things, we're even at even higher risk of having bone fractures, or osteoporosis and osteopenia. So it kind of makes the vitamin D and calcium even more important. With iron deficiency, if it's becoming an issue, we can go on to develop anemia. So those red blood cells aren't, they're fewer in number, and they're not really able to carry the oxygen appropriately throughout our bodies. So we can get very fatigued, we can bruise very easily, we can start having things like dizziness or headaches. One of the kind of telltale signs of an iron deficiency anemia as well is if you ever start craving non-food items. So sometimes people might really, crave chewing on ice chips, or I've had patients who have actually said they start craving dirt or kind of metallic tasting things. And it can be linked potentially to an iron deficiency anemia. And then even in further stages, having things like shortness of breath or just overall poor appetite are also possible. In vitamin A deficiency, we might experience things like dry eye or dry skin, even night blindness if it's severe enough. And then down the road, things such as increased infection risk or poor wound healing. And then with our B vitamins, some of them are very rare deficiencies, even in folks with some degree of malnutrition or weight loss. But the ones that are a little bit more common would be a vitamin B1 or thiamine deficiency, which can cause loss of appetite, weakness, pain in the limbs, and even things like shortness of breath. A folate or a folic acid deficiency can cause similar symptoms, so things such as weakness and tiredness, headaches, shortness of breath, or just kind of difficulty concentrating overall. So folic acid is the supplement form of vitamin B9, whereas folate is the form that we would get from food, so sort of the naturally occurring form. And then vitamin B12 is also among the general population a fairly common deficiency, particularly in folks with that are vegan or vegetarian, because it's primarily found in animal-based products or animal-based foods. But similar symptoms, again, sort of this numbness and tingling, weakness and fatigue, even going on to maybe develop some cognitive or memory loss issues, this overall poor coordination. So I bring these deficiencies up because we can kind of see that a lot of these symptoms of certain vitamin or mineral deficiencies, poor coordination, numbness and tingling, things like that, can kind of mimic or mirror some of the symptoms we might be experiencing with certain neuromuscular conditions. So we would never want any of our symptoms to be attributed just to neuromuscular disease itself and possibly be masking a potential nutrient deficiency. So it's always good to discuss with your physician if they feel it's appropriate to get levels checked just to make sure that deficiencies can be ruled out, especially in folks who aren't eating as much or have had maybe a significant weight loss, over a shorter period of time. So then overall, kind of this all-encompassing of the factors that we've been discussing, GI issues, swallowing difficulty, self-feeding ability, weight loss, and sort of overall malnutrition can absolutely, occur, and it's very common. So with weight loss too, it's not just that we're losing fat mass, but the potential for losing muscle mass is certainly there. And that's really the thing that we want to kind of preserve as best we can. So this is sort of a culmination of all of these complications. And with weight loss and malnutrition overall, it can affect several different factors of our bodies and of our lives, but just kind of that overall decreased quality of life is something to think about and something that can significantly impact us. And because of this, research has shown that with significant unintentional weight loss and malnutrition in chronic disease and in neuromuscular disease in particular, there can certainly be poor health outcomes overall, or more differences in overall prognosis of the disease. So we kind of discussed the concerns and the complications. So why do we think nutrition is important for those with neuromuscular disease? So of course we want to have appropriate and adequate nutrition to help with weight loss prevention. And with preventing weight loss, the goal then is also to help preserve as much muscle mass as we can and lean body mass as we can, which can then help overall, us to preserve our strength and our energy levels and just improve that quality of life overall so that we can potentially have better health outcomes and just live a better life overall. So what are some of the interventions that we can utilize? So first and foremost, as I've kind of been discussing, stabilizing weight is one of our main goals and one of the things that we want to try to strive for as best we can. So with that, even for folks that might have a higher weight or a higher BMI, or that might be in sort of an overweight or obese category, the goal is certainly not for weight loss, but rather to help, to stabilize weight to avoid unintentionally losing weight. So folks who have had significant weight loss, again, the goal is not necessarily that we're going to get you back to whatever weight was sort of your highest weight or whatever weight you were prior to losing. The goal, first and foremost, is to just keep you from losing further weight. So to keep weight as stable as possible. If a little bit of weight gain occurs, that's fantastic. However, the first and foremost goal would be to prevent from further weight loss, which can then prevent overall malnutrition or at least help prolong the onset of those types of things. And we can do this through adequate calorie intake and adequate protein intake, which we'll discuss in just a minute. And using nutrient-rich foods so that we can help sort of stave off some of those potential nutrient deficiencies with our vitamins and minerals. Overall adequate hydration is extremely important. Potentially the use of certain medications from a GI standpoint can be helpful. And then from a more, feeding and swallowing standpoint, perhaps some texture modifications or adaptive equipment, or the possible use of alternative means of nutrition if that's something that we need to utilize. So with adequate calorie and protein intake, we're kind of always taught to eat healthy or eat a balanced diet. However, when we're really trying to maintain our weight, prevent unintentional muscle loss, we kind of want to take the focus off of just eating a healthy diet and sort of shift the focus to consuming, eating adequately and sort of putting the focus on getting the nutrition in. So using high calorie foods, condiments whenever we can, things that can really sort of bulk up our meals from a calorie or a protein standpoint without significantly increasing the volume of food that we have to eat if that's a challenge to get that meal intake in. So things like small frequent meals and snacks can be helpful. Use of oral nutrition supplements, so Boost, Ensure, Carnation Instant Breakfast, those types of things are excellent ways to help us maybe get a little bit more nutrition throughout the day without a large volume. Sometimes the use of appetite stimulants is helpful, which is something that can certainly be discussed with your physician if you feel like that's something that's really hindering your ability to consume food overall. Or, if you're having issues with constipation or having other GI issues, starting a bowel regimen or maybe some fiber or something like that can possibly be helpful too. So that's not something that's hindering your ability to eat. So just some examples of high calorie foods that can be added to meals or added to snacks, utilizing things like cream or butter or sour cream, mayonnaise, using oils and avocados to really bulk up your meals without having to bulk up that volume. So again, not that these foods are necessarily things that we would say, oh, this butter or mayo, these are the healthiest foods in the world. Sure, we know that's probably not the case, but if it helps to add calories to our meals and it helps us to get that intake in to help prevent weight loss, then looking at that as a benefit or as a positive thing is very important. So in addition to just meeting calorie needs, focusing on higher protein foods can be very beneficial too, just to help sort of fuel those muscles. So any of our meat and poultry, fish and seafood, things such as eggs. If we're doing more plant-based protein sources, nuts and seeds, beans and lentils, peanut butters, nut butters, those are all great sources. Soy-based products are great. And then again, using things if need be, such as the Ensure shakes or Boost. Those are great ways to add further protein and calories into our overall diet. If we're concerned about nutrient deficiencies overall, trying to, if we can, include foods that do naturally contain some of these vitamins and minerals is important. So with vitamin D, things such as salmon or certain fish like herring and sardines, egg yolks, a lot of our fortified foods might have some vitamin D in there too, like our milk or soy milk or orange juice. So always great to try to include nutrient-rich foods as well. Calcium-rich foods, we tend to think of dairy, you know, as one of the first things when we're thinking calcium, but we can certainly get calcium from other foods such as spinach, kale, a lot of our dark leafy greens, things like beans and lentils, dried fruits, and some of our fortified foods as well, so cereals and things like that that have calcium added in. Iron-rich foods, a lot of times we think, oh, steak or red meat, which is certainly a great source of iron, but we can also get it from other foods such as tofu or canned beans or lentils, things such as nuts and seeds, and even some of our veggies. And a fun fact with vegetables, dark green veggies, things like that, if we squeeze a little bit of lemon juice or a little bit of lime juice, something that has vitamin C, it helps us absorb that iron a little bit more efficiently. Vitamin A-rich foods are going to be things like sweet potatoes and carrots and pumpkins, spinach. Lots of our produce can give us some of that vitamin A to help prevent that deficiency. Vitamin B1, that's going to be a lot of our cereals and whole grains, pork and beef, lentils, nuts, all sorts of foods such as that can help get us that thiamine. Folate-rich foods, that's going to be things like beef, liver, asparagus, some things like oranges, nuts, and beans. And then again, a lot of our fortified foods, so cereals or pastas, a lot of times are fortified with folate to help increase our intake. And then vitamin B12 foods, again, mostly from animal-based products. A couple of the plant-based sources would be things like cereals that are fortified with vitamin B12, or something like nutritional yeast, which is a vegan product that can be added to foods to sort of boost up vitamin B12 intake. And then with adequate hydration, our bodies, every cell in our body needs water to survive. So hydration is not just good for, making us feel good, helping us sort of with mental clarity and energy, giving our brain, adequate hydration. It also can be very important for helping to keep our bowels more regular. So it helps kind of move things along our digestive system and help us to get some of that waste out of our bodies, which can improve organ function, for our bowels and our kidneys, improve our joints, even give us like lubrication for our joints, and overall help with maybe decreasing overall infection risk if we're able to sort of get those toxins out of our bodies. So kind of the rule of thumb for hydration would be, it's different for everybody based on weight and overall needs, but if urine color looks more like apple juice versus lemonade, then probably on the dry side or on the dehydrated side. So we want our urine color to look more like lemonade versus apple juice. Here are some of the GI medications that could be something to talk to your physician about if you feel like you're having issues with constipation, or you need a little bit, or appetite problems. There are different medications out there, some over the counter. So for instance, fiber supplements like Metamucil or Benefiber are great ways to be able to add a little bit of extra fiber into the diet to maybe help keep bowels a little bit more regular. Other kind of stronger things like stool softeners or laxatives can be very helpful. And then certain appetite stimulants can possibly help, help our appetite overall if we're having those issues. So talking to your doctor about, or your dietitian about that can be helpful. And then from a swallowing standpoint, again, working with a speech language pathologist can be very important to get the proper recommendations if any texture modifications are necessary. So maybe pureed foods or just softer solids or things like thickened liquids might be needed in order to have safer swallowing and safer chewing to prevent that aspiration risk from occurring. And then with the feeding ability overall, working with your occupational therapist to see if any sort of adaptive equipment or materials like that are necessary. So lots of different products out there that can help, with sort of self-feeding if we're having upper body impairment from neuromuscular disease. So different types of ways that it can make it a little bit easier, a little bit more manageable for us at meals. So these are just some to give you an idea. Feeding tube placement, that's certainly something that is a great conversation to have with your physician or with your loved ones to see if neuromuscular disease is really significantly impacting swallowing ability and it's making it more difficult to eat or take medications or get adequate hydration. this is a discussion that, if it's appropriate, sometimes can be of benefit to have supplemental access for feeding. So it can possibly help stabilize weight and provide a more consistent source of nutrition and hydration, and access for certain medications. And with a feeding tube, a lot of times I think, it's important to always highlight that it doesn't always mean that you can't eat by mouth. In most cases, if you're safe enough to have an oral diet, you can do both tube feeds and eat orally for pleasure, but then it sort of takes the pressure off of feeling like you have to meet your needs from food alone, from orally, where we can meet needs through a feeding tube, and then whatever is taken by mouth is more for pleasure. There are certainly some cons or some things that to think about in terms of alternative means of nutrition. So infection risk is a concern, or a risk. And then, just keeping in mind that a feeding tube doesn't always stabilize weight, or it doesn't always help with overall nutrition status. It kind of depends on the person, the time that a feeding tube is placed, like how far into disease progression someone is, but certainly something to think about or discuss with your physician if you feel like that might be a concern or a need of yours to have some supplemental access. So it kind of looks like this, just to give an idea. It goes right into the stomach, and there are sort of different ways of feeding. Feeding overnight, feeding kind of meal feeding throughout the day, a continuous pump. So different ways that nutrition can be administered. So last thing I just wanted to touch on were supplements can be a very hot topic in disease management. So there were just a few that I wanted to address that maybe you've read about or heard about or asked your physician about. Just as something to kind of discuss. So branched chain amino acids, this is something that is a very popular supplement, especially in like the fitness world, because of the claims that it can increase protein synthesis as it is an amino acid. Our bodies don't make this amino acid, so we do have to get it through food. However, research has kind of shown that it doesn't necessarily prevent muscle or protein breakdown, especially in folks with neuromuscular disease, mainly ALS and Duchenne muscular dystrophy are kind of where a lot of these studies come from in these particular diseases. So overall consensus is that it's probably not able to prevent this protein breakdown, and it can have potential side effects, especially GI related. But luckily we can get branched chain amino acids through food. So things like milk, poultry, eggs, whole wheat, nuts, all great ways to get branched chain amino acids. L-Arginine and L-Citrulline are also two supplements that have been, I'd say in the last couple of years, more in the news or more researched for the claims that it could potentially counteract muscle wasting because they are amino acids involved in our metabolism. However, their results have shown that there could potentially be some slowing of muscle degradation. However, keeping in mind that these studies are mostly animal studies, not necessarily in humans, and particularly focused on Duchenne muscular dystrophy versus any other neuromuscular conditions. And again, of course, a lot of these supplements do have potential side effects, but we can get these nutrients through food as well. Creatine is another supplement that, again, very popular in the fitness world, but the claim is that it can potentially increase protein synthesis or help decrease protein breakdown. With this, overall consensus is that it may help decrease protein breakdown or muscle breakdown. It may, help with functional strength overall, but it's not necessarily 100% effective, and it's only really been studied in certain neuromuscular conditions. So always speak with your physician if this is something that you think would be helpful. But there's no guarantee, and there's no solid research saying that that it's true to its claim. And excess can be problematic. So getting it through food is certainly the way to go. Glutamine is another supplement that is kind of popular or more in the news recently because of its potential antioxidant properties or claims that it helps with immune function and muscle gain. Unfortunately, there's consensus overall is that there's really no benefit to taking this supplement, and that it can have some GI related side effects. And getting it through food, of course, first would be the recommendation. Green tea extract, again, antioxidant property claims, energy boosting claims. Again, very poor evidence, nothing to support its function or its use, especially in neuromuscular disease. And this particular one can have several interactions with actual prescription medications and make those less effective. So kind of even worse potential interactions with this one. Omega-3 fatty acids, claims of anti-inflammatory properties. Consensus overall, it may help a little bit with progression of muscle loss. It may decrease fat mass overall. However, it's not necessarily recommended for this particular purpose, especially in folks with neuromuscular disease. And getting it through food first is certainly what we want to do. CoQ10, one that can potentially decrease inflammation, but again, may have some benefits, but results are really inconclusive overall and not necessarily recommended. And again, keep in mind, a lot of these studies are for one or two particular neuromuscular conditions and mostly animal studies. So vitamin D is the last one I want to touch on because it is one of the only recommended supplements at this time just to help with that kind of preserving bone health and overall, because a lot of us tend to be deficient. So especially if we've had weight loss or we're not eating as much. So this is certainly something, a good level to get checked by your physician if you think, you might have a deficiency or you're just not sure. Something to definitely consider, and a very safe supplement in the right dose. So always good to work with your physician about checking these levels, because it is difficult to get vitamin D through food alone. And the last thing I'll say about supplements is that they are not regulated by the FDA like medications are. So sometimes, a supplement might say it has this list of ingredients in there, but there could be other things that can be contaminants or can, affect our prescription medication effectiveness as well. So, always trying to get things through food first is certainly the way to go. So in summary, in the management from a nutrition standpoint of neuromuscular disease, dieting is not something that's recommended. Really just being able to maximize your nutritional intake through food first, modifying the textures of diets as needed, as recommended by a speech pathologist, and really focusing on maximizing our calorie and protein intake without significantly increasing the volume of food, with the goal first and foremost of weight maintenance. So again, getting nutrients through food first, and always speak to your physician about any questions related to supplement use and the like. Okay. So thank you so much for your time today.
Thank you. Thank you for that. We do have a couple questions for you.
Sure.
This person has Becker's. They're in their mid-30s. What should they ask their doctor to make sure that they should do to be on the right track for nutrition?
Yeah, great question. So I would first and foremost, if any swallowing issues are occurring, working with a speech pathologist to determine appropriate texture of diet. If there need to be any modifications, that can be very important. Again, if you've never had a vitamin or mineral levels assessed, it could be something worth looking into just to make sure symptoms from neuromuscular disease itself aren't kind of masking any potential nutrient deficiencies, but really focusing on, eating consistently throughout the day, avoiding skipping meals, and sort of maximizing getting enough calories, getting good protein sources through nutrient-dense foods would be sort of first and foremost. So no restrictions unless it's from a swallowing or texture standpoint. So kind of all foods are good foods, and eating adequately throughout the day.
That's a big thing, no dieting, you said. And I feel like that's a lot of people's first go-to is, what diet do I need to hop on?
Absolutely. Absolutely.
This person's commenting that says drinking is difficult and they need to thicken their liquids, which is not quenching their thirst. Do you have any tips or tricks for that?
That's a great question. So certain, getting that thirst quenching sensation, certainly can be challenging with the thickened liquids,
Mm-hmm.
but sometimes using foods that are a little bit more hydrating. So if it's safe for you to eat things like watermelon or, you know, berries or things like that, that have a little bit more, they're a little bit more hydrating, or, you know, broth-based soups or things like that, that can get a little bit of those liquids in, or a little bit more hydration in a perhaps a safer way.
That's
Also
nice.
doing things like you know, having like sugar-free hard candies or things like that can be helpful, just to sort of stimulate saliva production or keep the mouth a little bit more moist. And the last thing, biotin is a type of mouthwash that can help sort of stimulate keeping the mouth a little bit more moist. So that could be something to look into if it's sort of this dryness can be affecting you.
That's great. Thank you for that. You also mentioned there's issues with taking too much L-Arginine. Can you expand on that? What foods or what should we consider in supplements then?
Yeah, so great question. So with the L-Arginine, a lot of these, I'm just going back to my notes so I can tell exactly the food sources, but a lot of the side effects can be GI related. So diarrhea, abdominal pain, bloating, nausea, things like that are a lot of these effects from supplements. But with the L-Arginine, there has actually been some studies showing that it can have a hypotensive effect. So it could potentially lower blood pressure just because of its regulation in our nitric oxide metabolism. So if folks have issues with blood pressure regulation to begin with, it could be you know, something that might be a problematic. So again, it's one of those things that, because they're not FDA regulated, it's very hard to give recommendations for dosing and to give, you know, frequency of taking these supplements, or to really know what's in them to begin with. So foods such as watermelon, meats and poultries, legumes, so beans and lentils, soybeans and dairy are all good sources of L-Arginine and the L-Citrulline. So trying to consume those foods or use those at meals and snacks can be a great way to get those in. And our bodies do make these two amino acids, so our needs probably aren't, you know, through the roof, because our bodies do produce some of these to some degree naturally.
Okay. This person has IBM and a feeding tube, and they're curious how they can incorporate more plant-based foods into their diet. The problem too is they can't weigh themselves because they're immobile.
Sure. That can be very tricky with weighing, just because of that very factor. Sometimes, you know, if you're wearing the same clothing or the same type of pants frequently, just kind of assessing overall how clothes are fitting. If you feel like things are hanging off of you a little bit more, even like measuring waist circumference every couple weeks or every month or so can be helpful, just to kind of get a little bit better assessment. But from a plant-based standpoint, there are several more plant-based feeding formulas out there. So Kate Farms, Real Food Blends, what's the other one? Liquid Hope. There are certain plant-based supplements that can be purchased. Ensure just came out with one that's a plant-based product as well. Or if you're doing more home blended tube feedings, using things like soy milk, to get good protein that's plant-based can be helpful, just to help, you know, kind of get a little bit more in terms of nutrition.
Okay, I just want to be cognizant of our time here.
Do you know
how we can find a gastric dietitian? I know in our last symposium we had a gastroenterologist talking about reducing fiber and to locate a gastric dietitian. Do you know how anyone can go about finding one of those in their area?
On the eatright.org, it's the Academy of Nutrition and Dietetics website. There is a function, and I think it's pretty up to date, that is, I think it's called Find a Dietitian or Find an RD or something like that, that you can search for your area and kind of see what's available. Some of them, it kind of lists dietitians in all sectors, so private practice, ones associated with hospitals. But if there is maybe a clinic, or if you're working with somebody in an MDA or an ALS association, asking for resources or references or referral to a dietitian can be helpful. But I would try the eatright.org website and see if anything comes up in your area.
Okay, and I typed that into the chat so everyone
Oh,
can
great.
see that.
Thank you.
Curious too about when you're overweight. You mentioned, trying to gain weight or maintaining your weight, but when you are overweight, any suggestions on what to do there to try to lose weight? I know portion control obviously is something, and obviously your choice of foods, but is there anything you can suggest to those that are overweight?
Sure. So I think with that, the goal wouldn't necessarily be to try to lose a significant amount of weight through restricting, calories or restricting protein, but just sort of overall more balanced meals. So kind of the gold standard I would say would be, if you have your plate overall, trying to make about half of your plate really nutrient-rich foods, so vegetables, fruits, things like that, if those are foods that you're able to eat.
Mm-hmm.
And then using about a quarter of your plate for a lean protein source, so whether that's a lean meat-based source or a plant-based protein, and then the other quarter reserved for something maybe whole grain or starchy or a little bit more nutrient-dense carbohydrate. It's kind of a good sort of way to just envision portion sizes. While eating consistently throughout the day. So I think a lot of us think, oh, the less we eat, the more weight we'll lose, but it kind of can be counterproductive to our metabolism. So actually having, more consistent meals throughout the day can be helpful, and listening to our hunger cues, not, ignoring those. And staying hydrated is a big one too.
Okay. And I just want to wrap up here, but I wanted to touch base with this one last comment. This person is just curious whether or not you believe there is any way, or if you have known of anyone, to set up a controlled study of dietary supplements, specifically determine if they do actually slow or reverse any muscular dystrophy disease progression. Are you aware of anything like that?
Unfortunately, I'm not aware of any database or any way to kind of assess that, just from studies that you might kind of, look up and see sort of disease specific. But I will say there aren't very many, it's a lot of these specific diseases aren't very well researched. I would say ALS and DMD are the most well researched when it comes to supplementation and things along those lines. So unfortunately, I'm not aware of any more database type of a system.
Okay. Well, thank you very much. I definitely appreciate your time today. And we are going to take a quick break, and we will be back with Allison. So thanks, Jamie. Have a great rest of your day.
You too. Thank you so much.